The state COVID-19 war room has estimated that by August 15, the state will have 20,000 to 25,000 COVID cases. The state capital, Bangalore, has for the past few days contributed to the highest number of COVID cases among all districts in Karnataka. In this episode of Backtrack, we look at the COVID preparedness of hospitals in the state capital. From June 8th to 21st, in a span of 2 weeks, Bangalore has seen 796 fresh COVID-19 cases. In a disturbing sign, the source of infection is not known for 522 of them. These cases have been categorized as contacts under tracing. Contact tracing is an essential public health tool for controlling the virus. It helps manage people exposed to the disease to prevent onward transmission. While on one hand, the sheer number of contacts under tracing is worrying, the number of tests have reduced drastically. Despite fewer tests being done, the cases have hit triple figures for consecutive days. So what happens once a person tests positive? Are there enough beds in Bengaluru's designated COVID hospitals? There are three parts to this story. The initial hospital infrastructure that the government had announced, the infrastructure added to this during the lockdown, and the inclusion of private hospitals once the nationwide lockdown was lifted. Before the lockdown, in March, CM Yadurappa had announced that 1,200 beds would be set aside at Victoria Hospital campus for COVID patients. By early April, the Health Commissioner, Pankaj Kumar Pandey, ruled out 650 of these 1,200 beds as there were no alternatives for patients at Vani Vilas Hospital, Institute of Nephrology, and the Mahabodhi Burns Ward. All these are hospitals that come under the Victoria Hospital cluster. When Bengaluru entered the lockdown, the number of promised beds were already down by half. Take a look now at the ICU beds. According to an official audit reported on June 19, the city has just 76 ICU beds for 1.2 crore people living in Bengaluru. These are COVID ICU beds. The city's hospitals are rapidly filling up and there are simply not enough ICUs and ventilators. 3 weeks after the lockdown was lifted, all hospitals affiliated to the BMCRI, including Victoria Hospital, had 36 ICU beds. And they were all full. A fact-finding committee appointed by the centre had declared Victoria Hospital to be a model facility for the nation. The situation at Bengaluru's other dedicated COVID-19 hospitals wasn't different and was in fact worse. Jayanagar General Hospital has 7 ICU beds and 6 ventilators. Malleshwaram's KC General Hospital has 6 ICU beds and 4 ventilators. Bowring and Lady Curzon Hospital has 20 ICU beds, out of which 14 are vacant. RGICD has 6 beds in its ICU unit and 4 ventilators. The director of RGICD has said that there are no intensivists in the hospital to operate these units. At the CV Raman General Hospital, intensive care units weren't functional. Take a look now at the number of general beds available. Victoria Hospital currently has 410 patients and can accommodate just 10 more cases. Rajiv Gandhi Institute of Chest Diseases with 104 beds has just 2 more beds available and only for women. Bowring and Lady Curzon Hospital has 155 isolation beds, out of which 4 are vacant. The 4th COVID hospital, by Infosys, is still under construction. That's a total of 76 ICU beds and less than 700 general beds currently available for Bengaluru. Despite doctors, public health officials and policemen falling sick due to the rapidly spreading virus, the PMSSY Super Specialty Hospital with its 210-bed facility is being used as a quarantine hotel for the medical staff at BMCRI. Now, in a desperate bid to ramp up capacity, a government notification on June 20th said that 16 government hospitals around the city will function as dedicated COVID health centers. But this remains only on paper. Health Department Director Om Prakash Patil told us that initially work on 8 hospitals will be taken up. So far, COVID patients have been admitted to ESI Hospital, Jayanagar. From this list of 16 hospitals, 3 hospitals, Jayanagar General, KC General and CV Raman General Hospitals, have been admitting COVID patients since the start of the pandemic. CV Raman General Hospital, ESI Hospital in Indranagar, Devanahalli General Hospital and Leprosy Hospital on Magdi Road have 0 ICU bed capacity. And now, the state has brought in a new discharge policy on June 23rd to clear up existing occupancy in hospitals. According to this, asymptomatic patients who had tested positive and don't show symptoms for 10 days from the date of the test will now be discharged. In case of mild and moderate infections, the patient will be discharged after 10 days of the onset of symptoms. Under the new discharge policy, a test will be conducted only for severe cases, 3 days after complete clinical recovery. Meanwhile, the state government realized that the public health institute institutions aren't able to accommodate rapidly increasing caseloads and have sought to involve private healthcare providers. Out of the 518 private hospitals listed across Karnataka, 44 are situated in Bengaluru. But were they given enough time to prepare before the notification was rolled out? Most of the hospitals Deccan Herald contacted said that they cannot take in COVID-19 patients and were not equipped for it in terms of isolation wards, beds, oxygen and respiratory illness specialists. Heart hospitals and cancer hospitals said that they have immunocompromised patients and cannot risk taking in COVID patients. And so finally, the Karnataka government has released the rates for COVID-19 treatment at private hospitals. On an average, it has been seen that patients in Karnataka take about 17 days to make a full recovery from COVID-19, and very few have recovered within 10 days. If you do a quick calculation, this means that a patient will have to shell out up to 1.7 lakh rupees for treatment at general wards. For treatment in an ICU with a ventilator, it will cost a patient more than 4 lakh rupees for the same period. You have two options before you. You could choose to go to a public hospital, but if it is full, you will be referred to one of the private COVID hospitals where you will still receive free treatment. The other option is to walk into a private hospital and pay the fee fixed by the government. Following criticism that most of the hospitals were not equipped to deal with COVID patients, on June 25th, the Health and Family Welfare Department made a significant announcement. It is mandatory for all private hospitals and nursing homes that have the facilities to treat COVID-19 patients to share 50% of their beds. The order excludes eye hospitals and dental care hospitals. And if you think your medical insurance will take care of hospitalization costs, here's some bad news. These rates do not apply to patients seeking a claim under their medical insurance, which brings us to the question, did Bengaluru squander the opportunity it had to ramp up its medical infrastructure during the lockdown? And is the city on the verge of a collapse of public healthcare? Do let us know in the comments below.